My name is Edwina Anyango. I work at the Ministry of Health National Vaccines and Immunization Program. My role in the National Vaccines and Immunization Program is to coordinate service delivery for the immunization services and also capacity building coordination. My role is basically to ensure that the service provision, that is the MR and TCV SIA's implementation, is of good quality in terms of good quality service provision, where we engage healthcare workers in handling, storage, administration, and the other rollout plans for immunization. So number two is to ensure we strengthen the skills of the healthcare workers who are going to be engaged during this SIS, that is the supplemental immunization activities that are planned, by one, ensuring that we develop guidelines and policies that will help us to have quality provision. Number two, to develop a good rollout plan in terms of capacity building and engagement at every level, and also ensuring that we coordinate the mentorship in the course of the supplemental immunization activities. In terms of capacity building, that is key, I think I've mentioned earlier, knowledge, by ensuring the training package has been adopted and executed well up to the health facility level where we target the vaccinators. Number two, in terms of the service provision, our core entity is to ensure that the handling, storage, and immunization of, which is core in this campaign, and documentation and advocacy come as a whole content within the service provision. However, what we strengthen more in terms of ensuring there's good quality provision is the handling, storage, and administration, and to ensure that the healthcare workers who are engaged in this service that we are going to have, that is the SIAs, are competently trained and also coordinated, and in the course of the service provision are also supervised or mentored, just to ensure there's quality provision of the service delivery. For every SIS that we have as a training and service delivery committee where I take lead, we also focus on the lessons learned. And this is to ensure that we strengthen on areas that we have challenges and also pick the best practices. So at any time and any level where we engage at a national level and the county and the sub-county, we engage them earlier in terms of ensuring we borrow a lot to strengthen the package that we are developing. For example, the issues of safety, ensuring the advanced events following immunization that are very common, especially with mass vaccination, standard practices that can be improved based on what happened before. Some of the even good practices are things that we borrow a lot. So in terms of service delivery, we look at the previous implementation services, some of the good practices. We even engage counties in our planning level. For example, we have webinars to disseminate the information. They raise the key issues that they want us to put in place or even to adhere to before we start the campaign. So service delivery is very holistic. Other than just training, we focus on practices. And for practices, we focus on the lessons learned, both the challenges and the good practices, to build on what we have for this year. This time, I think the lessons learned is that we started preparing early enough, having in mind that we are having a larger big cohort that we are targeting with the campaign, unlike other campaigns that probably are 5 years and below. So the engagement from the community level and the key stakeholder, I like calling the healthcare workers the key stakeholders in terms of service provision. So we engage them from the national, the county level, through the media, social media platforms like the WhatsApp platform. And what has worked well so much is also the webinars, where we have presentation of the anticipated campaign, and then they raise matters, they ask questions, and this also builds on them. They start even advocacy at the level early. Some of the matters arising during the webinars also help us as a program in terms of service provision. What do we need to anchor so much in our training package based on some of the gaps that you're already identifying in terms of the engagement? In terms of documentation, this is something, of course, we strengthen routinely, but in terms of the larger SIS, documentation is very key. So this is a component also we develop. There's a module in the trainings where we strengthen so much on documentation and monitoring and roles and responsibility of each healthcare worker at every level. So it comes very clear by the time we start the SIAs, all healthcare workers at different levels, they know their roles and responsibility, and each level of supervision, they know who to engage in case of any matters arising. My message to the public is that, number one, as a country, this is a very good opportunity for us. Just a few months ago, we had the big catch-up where we are targeting numbers of unvaccinated and missed children and the other adolescents and the adults for vaccination. For Measles Rubella, this is a very good opportunity because it's a catch-up campaign where it's a good opportunity for reaching the unreached either with measles dose 1 and dose 2. And this will help in the reduction of the disease in terms of allowing other populations who had not received the vaccines. And also for the typhoid conjugate vaccine, since we are going to introduce it routinely for the SIS, I think it's also good because we are targeting 9 months to 14 years. But during introduction, it's going to be at 9 months. So I'm assuring the public, number one, the vaccines are very safe. The government has followed all the protocols in terms of safety. We have also engaged the KENITAG, which is the Kenya National Technical Advisory Group for Immunization, in terms of safety, efficacy, and the programmatic implications. So by the time we come to deliver a training package for service delivery, we've considered a lot of aspects, and we've put this like in a summary to enable our healthcare workers understand it more. One thing I want to emphasize so much is that we have very positive engagement with the counties, both at the community level and the facility level. And even beyond that, among healthcare workman force, we are focusing on all the healthcare workers, including the private practitioners. So please let us take this advantage. Let us sell out this idea to our entire families. It's a very good opportunity to help us to strengthen and also to improve our immunization in the country.